First aid for a severe allergic reaction.
Oh, I think I've been stung. I'll go and get Mum.
Mum's here.
Look for a red blotchy rash and swelling. Their breathing may slow down.
Looks like you're having a reaction. Yes, my daughter's having an allergic reaction. Yeah, her breathing's very hard. She's got a red blotchy face. It's 6 Child's Way.
Reassure the child and make them as comfortable as possible.
Relax. It's okay. I think that's them.
First aid for an asthma attack.
Harry? Okay, Harry, stay there, stay there. Sit yourself down, Harry. Okay, keep calm. Daddy's going to go get your asthma pump, okay?
Help the child to sit in a comfortable position and to take their medication.
Ready? Now. And hold it, and hold it. Good. Okay, one more time.
Reassure the child. If the attack becomes severe, or they don't have their medication,
Thanks, Dad.
Oh, that's all right, that's all right.
remember, help them take their medication. First aid for a baby who is choking.
Emily? All right, Emily, sweetheart. Daddy knows what to do. Shh.
Give up to 5 back blows.
You cough it up.
Hit them firmly between the shoulder blades.
Come on, baby, cough it up for Daddy, please. Come on.
Give up to 5 chest
Cough it
thrusts.
up for Daddy, please.
Push inwards and upwards.
Cough it up for Daddy, please. Come on.
If the object has not dislodged after 3 cycles of 5 back blows and 5 chest thrusts.
There we go, baby. There we go. That's a good girl. That's a good girl.
Remember, give back blows and chest thrusts. First aid for a baby who's unconscious and breathing.
Emily? Emily, sweetheart? Emily? Emily, sweetheart, wake up. It's bath time. Emily?
Check breathing by tilting their head back. Look and feel for breaths. Hold the baby on their side, with their head slightly tilted back and supported.
Yeah, hello, ambulance, please. Yeah, hello. It's my baby daughter. She's unconscious, but she's breathing. Yes, I've got her on her side now. Yes, 6 Charles Street. Okay, thank you.
Remember, hold the baby on their side with their head tilted back. First aid for a baby who's unconscious and not breathing.
Emily. Honey. Emily, come on, wake up. John!
Check breathing by tilting their head back. Look and feel for breaths.
What's wrong? What's wrong?
She's not breathing. Call an ambulance, quickly.
She's unconscious and not breathing.
Give 5 rescue breaths. Tilt their head back and seal your mouth over their mouth and nose. Blow 5 times into the baby.
Okay, please hurry.
Give 30 chest compressions. Push firmly in the middle of their chest with 2 fingers. Give 2 rescue breaths. Continue with 30 chest compressions and 2 rescue breaths until help arrives. Remember, give rescue breaths and chest compressions. First aid for bleeding heavily.
Ow!
You okay, Harry?
Put pressure on the wound to stop the flow of blood.
You all right there? You all right, son? What's the matter?
It's deep.
Okay. Yeah, hello, ambulance, please.
Okay, I'm just pressing on it to stop
Yeah,
the
it's my son.
bleeding.
He's cut himself quite badly and it's bleeding quite heavily.
Keep pressure on the wound until help arrives.
Okay.
Be brave.
Okay, they're on their way. All right, son, be brave.
Remember, put pressure on the wound. First aid for a broken bone.
Ow!
Oh, Sarah, what have you done? Sweetheart, bring your arm. That's it, support your arm for me, darling, okay?
What's
Can
happened?
you get us a pillow or cushion or something to support the arm, please?
Okay.
Okay, sweetheart, everything's going to be fine. Just try not to move your arm. There we go.
Support the injury to prevent unnecessary movement.
Okay, everything's going to be fine, sweetheart.
Ambulance. I think she's broken her arm. 6 Charles Street.
Continue supporting the injury until help arrives. Remember, keep the injury still and supported. First aid for burns.
Ow!
Sarah, can you get some water, please?
The hose.
Right, we're just going to put some cold water on it and soothe it.
Cool the burn under cold running water for at least 10 minutes.
Does that feel better? Get me a freezer bag and some tape as well, please. It's been 10 minutes.
Cover the burn with a clean plastic bag or cling film.
This will keep it clean and it won't hurt as much. That's it. I think we need to go to hospital.
Okay, I'll go and get the keys.
Okay.
Remember, cool the burn. First aid for a child who's choking.
Can you go and do your homework, please, Nadia?
But Mum, I don't want...
What's wrong? Are you choking? Cough it up!
Give up to 5 back blows.
Come on!
Hit them firmly between the shoulder blades. Give up to 5 abdominal thrusts. Pull inwards and upwards.
Come on, Nadia!
Call if the object has not dislodged after 3 cycles of 5 back blows and 5 abdominal thrusts. Remember, give back blows and abdominal thrusts. First aid for a child who's unconscious and breathing.
Nadia! Nadia, wake up! Nadia, what's happened? Can you hear me?
Check breathing by tilting their head back. Look and feel for breaths. Move them onto their side and tilt their head back.
Hi, I need an ambulance, please. It's my daughter. Yep, she's unconscious, but she's breathing.
Remember, move the child onto their side and tilt their head back. First aid for a child who's unconscious and not breathing.
Omar, your dinner's ready. Omar! 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 Omar, wake up, it's Daddy!
What's going on?
Check breathing by tilting their head back. Look and feel for breaths.
He's not breathing, call an ambulance!
Give 5 rescue breaths. Tilt their head back, pinch their nose and seal your mouth over their mouth. Blow 5 times into the child. Give 30 chest compressions. Push firmly in the middle of their chest with one hand. Give 2 rescue breaths. Continue with 30 chest compressions and 2 rescue breaths until help arrives. Remember, give rescue breaths and chest compressions. First aid for croup.
Nadia, sweetheart. Let's sit you up, okay, darling? It will help you breathe better, yeah? Yeah? I'll be back in a minute. Okay?
Create a steamy atmosphere by boiling a kettle or running a bath.
Okay, just sit at the edge of the bath for me. Yeah? And don't touch that water, it's really, really hot. Good girl.
Sit the child up and encourage them to breathe in the steam.
Let's take another deep breath for me, nice and slowly.
If the symptoms continue, seek medical advice. Remember, sit the child up and help them to breathe in a steamy atmosphere. First aid for a febrile seizure.
Warm in here, Emily. Emily?
Protect them from injury. Do not restrain them. Reduce their temperature by removing clothing.
It's all right. There you go, sweetheart. There we go. Okay, let's start cooling you down, honey. Okay?
When the seizure is over, help them to rest on their side with their head tilted back. Remember, protect them from injury and reduce their temperature. First aid for fever.
Feeling a little bit hot. I'll be back in a minute. Right. Okay, darling.
Check their temperature by using a thermometer.
Okay, good boy. That's it. You are hot. Okay, let's just get all this off. Come on.
Reduce their temperature by removing excess clothing and giving them regular fluids such as water or diluted juice.
Good boy, good boy. Right. Just come here.
Give the recommended dose of paracetamol syrup.
Okay, here you go. Good boy. Do you want to lie down? Okay. Okay, lie down. Good boy.
Remember, reduce their temperature. First aid for a head injury.
Nadia! Yeah. Nadia! Are you okay? We're going to put something cold on top of that to get the swelling down. Would you go to the freezer and get something for her head?
What happened?
You've fallen off the trampoline and bumped your head. I think you got knocked out for a bit.
Get the child to rest and apply something cold to the injury.
This will help get that bump down a bit. I think we're going to have to take her over to the doctors to get a check.
Remember, apply something cold. First aid for poisoning and harmful substances.
Tariq, where are you? No, what are you doing? Spit it out. Spit it out. Spit it out.
Establish what they have taken, when, and how much.
Ambulance, please. It's my 3-year-old. He's taking some sleeping pills. I've only just found him, but he's just taking them now. Five pills, I think. My address, 3 Mill Lane.
Remember, establish what, when, and how much. First aid for a seizure.
Oh, Harry. You're just having one of your seizures. Don't worry.
Mummy's here.
Protect them from injury.
Don't worry.
Do not restrain them.
Be all right. Just listen to my voice, Harry. Just going to check your breathing. You're all right. I'm just going to roll you over, Harry. Okay?
When the seizure is over, help them to rest on their side with their head tilted back.
There we go. Okay. That's it.
Remember, make them safe and prevent injury. First aid for a nosebleed.
Mum.
Oh, sweetheart, your nose is bleeding. I just need you to pinch the soft part of your nose for me like that.
Get the child to pinch the soft part of their nose. Ask them to lean forward.
Keep pinching your nose and remember to breathe through your mouth, all right?
Continue to pinch the nose for 10 minutes.
Okay, that will stop the bleeding. Spit in this bowl if you need to. Good girl. I'm just going to check and see if it stopped bleeding, okay? Yeah, that's good. It looks like it's stopped. I'm just going to need you to go and sit quietly for a little while, okay?
Seek medical advice if the bleeding continues for more than half an hour. Remember, pinch the soft part of the nose and lean forward. First aid for vomiting and diarrhoea.
Omar, sweetheart, it's Mummy. How are you feeling?
Give the child drinks of boiled water that's been cooled.
Can you have a few sips for me?
Encourage them to drink small sips often.
Can you have one more for me? Great. Well done.
Let the child rest.
And remember, there's a bowl down here if you need it, all right? I'll come and check on you later.
If symptoms persist, seek medical advice. Remember, ensure they rest and drink small sips of water often.